Hi, everybody. Family Matters PTIC has launched a podcast. We are adding this format as a way to reach more Illinois families and professionals with key information about disability support and special education advocacy and navigation. The podcast will bring the voice and experience of a variety of professionals and families to the table with a focus on exploring experiences, introducing best practices that are being implemented across the state, exploring services and support, and sharing the input and guidance of families. As a reminder, Family Matters PTIC is not a legal service, and we cannot provide legal advice. Information you receive from this podcast should not be construed as legal advice. Family Matters PTIC is one of the two federally funded parent training and information centers that serves Illinois. The contacts of this podcast were developed under a grant from the U.S. Department of Education. However, those contents do not necessarily represent the policies of the U.S. Department of Education, and you should not assume endorsement of the federal government. Okay. So today in our podcast, we're doing something just a little different. I'm interviewing Karrie Potter, educational support coach here at Family Matters. And Karrie, who will you be interviewing today?
I will be interviewing Abby Mars, who is also an educational support coach here at Family Matters.
So just a little bit different back and forth, but we thought that this format, this platform would be a great way to kind of introduce ourselves to our podcast viewers and get a little bit of history about Karrie and myself. So, with that being said, Karrie, I'm going to ask you our very first question. So, when did you know your family would be part of the disability world?
So I will say pretty much from the beginning. I was 17 when I had Zoe, almost 18. She was born premature. She was a micro preemie who weighed 1 pound and 5 ounces at birth. She came extremely earlier. So there was, a over 6 month NICU stay with multiple surgeries and medical issues throughout that first 6 months of her life, and even continuing once she came home. So really, I was just kind of thrown into that from basically the moment she was born. I didn't really know the extent of, how being born premature would impact her over the course of her life, but I did know that being born at 1 pound and 5 ounces, that she was, on a ventilator or an oscillator, then a ventilator and CPAP, oxygen, things like that throughout that first 6 months of life. So I knew there were going to be disabilities. And just kind of as minutes, days, time went on, we were kind of introduced to here's a new diagnosis. She's going to need surgeries for this. Here's a probability of, she's probably going to have cerebral palsy, things like that. We were kind of thrown into that from the beginning. So again, I didn't know to what extent, if she would be diagnosed with cerebral palsy, to what extent that would impact her, things like that. But I did know pretty early on.
So back then, so Zoe's going to be 23. So back then, were there any supports in place at the NICU? I know my niece was born in NICU 8 years ago, and at that time, other agencies came in and talked to my sister and brother-in-law and would say, there's a possibility of a learning disability later in life. Here are resources you may need. So was that in place then, Karrie?
I believe there was. I think at the time, we navigated a over 6 month stay in NICU. So, I was young at the time. I was with her that whole time, fortunate to be able to be with her that whole time. There were social workers who connected us to early intervention services when we went home. We were connected to good doctors locally, and help me navigate. I had a lot of support from the nurses, the social worker in NICU, things like that. Looking back, I see things in reports where things were introduced to me at the time where, she may be more at risk for this diagnosis or that with the things they were seeing. But I will say at the time, I think I was just kind of surviving and processing. You're really just processing each crisis as it comes, and okay, we've got to get through this surgery to see if it fixes this problem, and so I think at the time maybe that was further down the road to think about learning disabilities, things like that. I was just focusing on getting her to walk, things like that. But I would say we were very well supported in NICU with the nurses, with the social workers, with being connected to appropriate services such as early intervention. I do think all of the right connections were made. We were connected to like NICU clinic to follow up, and I think they evaluate children who have exited NICU for the first 2 or 3 years of their lives to see how they do. We were connected with all of those things um, along the way when we needed to be.
That's awesome. That is. I'm glad even those supports were there 23 years ago to start connecting pieces for sure.
Right. I mean it makes a world of difference. They always say it takes the community to raise a child. I have found, that's probably with any child. I only have one child and this is my experience, and I'm like it has definitely taken a community and a lot of people pulling together to teach me like, okay, here's some resources to help with this diagnosis and to help you understand it and how to meet her needs. I mean, there was somebody every step of the way to help me. So, it definitely does take a village, and I'm glad we've had a strong one to help us along the way, because it's definitely a lot for one person to do, or two parents to do. So, how about you, Abby?
So I was 19 when I had my oldest son. His name is Davin. He is soon to be 21 years old. We knew pretty well, I'd say around the first year, that he was having some struggles. He was having feeding issues, which led to a WIC screening, with a lower birth rate. And then we noticed he wasn't setting up on time. All the things started to roll. And like you, we started with early intervention, and we had some amazing, amazing therapists with early intervention. And our speech pathologist worked with him 3 times a week in our home, and she is the one that first said the word autism. And up until that point, the only thing I knew about autism was there was this really good movie called Rain Man that Tom Cruise was in. A thing about autism. I had, helped out in our church preschool classroom, and there was a young lady there that was on the spectrum. But the whole thing about the spectrum is, if you meet one person with autism, you've only ever met one person with autism. They're not anything alike to each other whatsoever. So, it led into a diagnosis of autism by age 2.5, and that was hard. I was recently divorced when we got that diagnosis, and David and I navigated a lot of things together on our path. And so David's official diagnosis of age 2.5 was autism and mental retardation, which we would now refer to as an intellectual disability. So he definitely has significant needs. Now I think, what is it? It's a level system of autism, so he would be level 3. But that's how we got our start in special education and in the disability world, in the disability community. So, but there weren't a lot of resources then. Our neuropsychologist just said, "I'm sorry, Mrs. Fisher, your son has autism. Have a nice day." I mean, there wasn't a lot extra there. And I asked him, "Well, what do we do from here?" And he handed me a puns pamphlet. So puns was the first resource that I was connected to through David's diagnosis.
And I think when you say that, like back then there weren't a lot of resources. In some ways, like when I look back, there were so many resources, but we were kind of like, there are all these medical conditions and all these issues from day like minute one. Like,
Mhm.
if you have a child between 22 and 24 weeks, they're not supposed to come till week 40. So in some ways, you're thrown in to all of that. I do think now with internet and things, like if I look
Mhm.
back to almost 23 years ago, resources weren't at your fingertips as much as they are
Exactly.
now. Like I didn't access Facebook. I don't even remember if Facebook was a thing when I was 17, or when that came out. So I think in some ways we can connect more now than we did,
Sure.
or there might be more specific support groups. I do remember thinking it was so hard to find a support group. Like there may be autism support groups and things like that, which are great, but like when you have a medically complex child, like one with they have all these diagnoses, it was hard to find people who
Mhm.
had a child, you know, a support group that focused on all those needs. I remember that was kind of a thing back then. There really wasn't always that support. And of course, other people my age weren't having kids then too. So maybe it was just like I didn't have that connection in that age group.
And we both live in a very rural community. So supports may have been because David was diagnosed at Carl Hospital in Champaign, and they did have a support group there for students for children with disabilities, but that was an hour and 45 minutes away from home, and there were specialists there that we already had to go see once, twice, a month, so that it was hard to, like you said, to you're so overwhelmed in the moment to take advantage of all the resources for sure.
Mhm. Yeah, I think back then it was just getting through, day to day and, not really looking at what's out there beyond just because we too, like there were times where therapy wasn't accessible around here for maybe occupational therapy. There was a shortage. She
Mhm.
needed it, so we drove to Springfield where she could get it, and we were already driving there for, multiple specialists and
Mhm.
surgeries and things like that. So, yeah, sometimes you're just focusing on what you need to and surviving at home.
Sure. Absolutely. So, let's jump ahead 3 years for Zoe and tell me if you remember your very first IEP meeting.
I do remember it, probably not detail for detail, but I do remember that it was kind of a hard transition in some ways because you transition from EI or early intervention. It's very, in the home. I remember thinking Zoe was more medically fragile. In that first 2.5 years, she'd had 15 surgeries. So we were, still navigating all of that. She couldn't, go to daycare as much as like maybe another child who's healthier, and doesn't have all that medical history. So, there were the worries like, is she going to get sick? How's the system going to be different from early intervention? She's going to be away from me, having her needs met. I did have the support of early intervention. I believe I was connected to Family Matters at that time because they were my parent center. I didn't work here at the time. So I did have some knowledge of how the IEP process would work, kind of who made up the IEP team, things like that. But it's still nerve-wracking when you're transitioning systems. So a transition from early intervention where they're in the home to that school system where she was going to be, not in my care, the care of a family member when I wasn't there. So I do remember the first IEP meeting and having the support of early intervention staff, I believe, came with me, some of them, not all. And I think, at first it seemed to all go well. There were some things we had to work through. Like I remember you mentioning Abby about David or people with autism. They say if you've met one person with autism, you've met one person with autism. I do remember some things working through, like Zoe has hydrocephalus. So if you've met one person with that, you've met one person. They're all impacted differently. So sometimes just navigating what supports does she need, sometimes out of concern, maybe I remember supports being proposed that, she hadn't needed but previously. So there were things like just working with the doctors to get letters to say, no, she doesn't really need to use a helmet and things like that at school. But I learned really quickly kind of how to navigate the IEP process with the support of working with parent center staff and just, being connected to resources that were helpful. Um, it seems like yesterday sometimes, and sometimes it seems like it was years ago, like it truly is. So do you remember David's first IEP meeting?
I do remember David's first IEP meeting. I was very fortunate to also have the support of my early intervention caseworker. She went with me to our first meeting, and I believe his speech pathologist also went. So I was really lucky, and that someone had shared the information with me that David could get outside services as well as school services. So, we were already applied for like speech services at Sarah Bush Lincoln and OT services there, and we're on the waiting list for that, as well as EI has an autism clinic and evaluation and supports there. So I'm sorry, EIU does. So we kind of had a plan. So David's birthday's in July. So I think our first IEP meeting was right at the end of school. So he was going to go a whole summer with no supports. So we were a little nervous about that. So those things were in place. And I remember that first. And I think the number one, even though I had so much support, overwhelmed, not knowing what this was going to look like forever. Like, this was my first child to even go to school, to know what a parent's role in education even is, let alone a special education parent's role. Um, so I definitely remember feeling overwhelmed. Very welcoming team. I knew the
Mhm.
preschool teacher, I knew the principal, but it was very overwhelming for sure.
It was, and I do remember, meeting different people, like going in and seeing the setting where she would, receive her education and what school building, things like that, that Zoe would be in. I remember meeting people; they were all very welcoming, very helpful. But it is kind of intimidating sometimes. You're walking into a setting with all new people and all new team members where you've had almost 3 years, 2.5, 3 years, or whatever, depending on how long your child was in early intervention, to build these relationships and bonds with them and know how to work together. So I think with the, first IEP, you're like, okay, I have to get to know all these new people. Some I've met, some I haven't, and like figure, how do we work together to get the most appropriate services in place for my child.
And I think that's the big thing there because you're going to have, which leads to our next question, you're going to have times when you don't agree with your team. You're a team, you're going to have disagreements. You're going to have times when you have different viewpoints or different expectations. So, can you give everybody some advice on how to navigate that process, Karrie?
Right. I think one thing that, um, I mean, I'm a person who doesn't really love conflict. Advocating for my child, one thing that was always important to me was for her to have the most inclusive education as possible, to be included with her peers, to be challenged and learn, have access to curriculum and things like that at school. I think, I like to think that everybody on an IEP team, we all have the same passion and the same expectations or want the same outcomes. We want, um, like Zoe would say, all team members want to see her learn and grow and make progress. I do think sometimes maybe it's multiple people working together. So I feel like anytime you have a group of people working together, you're going to have different personalities and um, different outlooks on what's the path we take to help that student get from point A to point B or the end goal. So I think sometimes like my vision may have been different than what another person's vision may have been on the team. But I think open communication is really helpful. I mean, even if you have differences on how to approach services and what you think may work, it's just talking through it. And I think as a parent, if you're struggling with advocating, I always say, there's a difference between being assertive and, kind of saying, no, this is what I think is going to help, or this is what I see as appropriate for them. There's a difference between being assertive and being aggressive. You want a good long-term working relationship with all IEP team members and between them all. And I think it's important to remember you're there for that student. That IEP is about them and looking at like what's going to help them in the long run. Even when they're 3 and you're starting the IEP process, you're kind of always looking to what's our end goal, like when they graduate. Like you're looking at building steps to building independence and trying to plan for their future and them to have the most fulfilling, meaningful life possible.
The first disagreement I remember with David was definitely placement. So our home district is very small and proposed a change in placement to a therapeutic day program in a neighboring town at just kindergarten. And it was very hard for me to take in all the information and really navigate what was right. And at that time, our district had a parent advocate on staff, a family support advocate. And we talked a lot about it. And I learned then about the importance of separating your positions from your interests.
Mm-hmm.
The goal was for David to not only be educated in a supportive environment, but be included too. And I think that's how we started off at this meeting, this first disagreement that we had as a team after 3 years of preschool. We navigated that path, and in the end, we did change his placement, and I don't regret that decision at all. And later on down the road, we changed it to the next step, and we chose residential at age 15, and he's done so amazing. And you have to get past those fears. I didn't want him on a bus for 45 minutes out of town. What if he needed me? What if the other parents there aren't as cool as the Shelbyville parents? Like all of these things that you're worried about. But just like in every other stage of parenting, you have to take a step and you have to educate yourself as much as you can about what that step's going to look like for sure.
Right. And I think you pointed out something, you know, valuable is, I mean, you have to look at what you didn't regret your decisions. And looking back, I'm like, I don't regret any decisions I made in advocating for Zoe. As she got older, she advocated more for herself. She's a pretty strong self advocate. But looking back, I'm like, anything that I advocated for, I don't really have any regrets. I feel like, you have to look at each individual differently, though, because what's least restrictive or what's the most appropriate placement for that individual. You have to look at what's appropriate for them, and each individual is going to be completely different. So I think, just the whole team keeping in mind, like, let's look at what's most appropriate for that individual. Um, but I think it's good when we can look back and say, we feel like what we advocated for was appropriate and help them in the long run.
Do you remember Zoe's last IEP meeting?
I do remember her last IEP meeting. She graduated in 2019. I think it was kind of like bittersweet. I think the special education world can be exhausting. When I look at it, I'm like, I've been doing it since I was 17, not necessarily special education, but just, living in the disability world and navigating special education since Zoe was 3 when she entered the school system. So I think in a way it was like I was kind of ready to move on to the next chapter, but it's always kind of bittersweet. Like you're leaving the comfort of what and the relationships you've built. The last IEP meeting she had was in April of 2019. She graduated in May. Just I remember talking a lot more about like adult services as she got older, even before her last IEP meeting, and just thinking, okay, the end of every chapter brings the beginning of a new one. So now we're just learning, the adult side of services and navigating that world. And I remember thinking it was kind of hard for her. I think she was ready for graduation, just probably the same as all of her friends.
Mm-hmm.
But it was also hard for her because she's like, I'm not going to see these people every day. Like Monday through Friday, I would see all my friends, things like that. I don't drive. So how do I access, my friends and things like that? Like, what am I going to do now? So I do remember it. And again, like I said, that process is a lot. So in some ways I'm like, I'm ready for the next chapter. To see her as an adult, things like that, and just see what life brings her way. But yeah, when I look back over everything, I think she had a good school experience, and um, it helped that she was ready to move on too, even though she was a little bit sad.
Sure.
How about you?
So
Where are you at?
Davin's he'll have one more IEP meeting in October of next year before he's finished with his educational services. So Davin did graduate with his district class in 2021 with all his friends from preschool basically, and he was much included in the celebrations and the graduation ceremony there, and that was wonderful. It was really great that my district was so supportive in that, and that is a student's right to be able to walk at their graduation. But I never even had to use those words with my district. They were very supportive, and that was a wonderful experience for both of us. So he's still receiving educational supports and currently is in Springfield at Hope, and we love Hope. Hope is our great family, and we'll be leaving them soon, and that's very hard. But um, so I remember our last IEP meeting last October. We had lots of people from outside agencies there because we're starting to navigate adult placement. So there was a lot of extra hands in the pot at this point, and I would like to say I'm less nervous than my first one. Maybe one of the IEP meetings in between, but this last one still really nervous because, like you said, you're opening a new door and closing the one behind you, and that's a huge leap to take. I have a very supportive environment with David. I've been remarried and I've had another son biologically and adopted two. Those two also have an IEP. So my IEP journey is far from over. But with David, it's starting to come to an end. And just really, I like that my team sees him as a person and not what he can't do. It's always been that way. They've always been able to see the potential that he has. He's very amazing. And of course, every parent says that about their kid that they're very amazing. But we're very, as you can see, he's prom king in the picture here at prom and in his graduation. And then the baby picture there is my little brother. He lived next door to me when I first had David. And again, our support system was always just there for sure.
And look at David, he is amazing. I mean, look how happy he is with graduation. And I think, that's one thing too. You mentioned like Zoe graduated with her graduating class in 2019. She didn't continue after, her senior year. She was done. But, you look at like having these experiences are a right for students to experience graduation. And you don't want to forget, like, those are just as important. They're not any less important experiences for a student just because they have a disability. And, um, you know, it's great when people are so supportive and you have a supportive community that
Yes.
works to them. But then I think, like you said, when you're closing that chapter, you're still going through the IEP process with David and have at least one more meeting. But adult services aren't always guaranteed depending on how you're navigating the system, or when you're exiting high school. Like, there's work to be done to
Mhm.
get things in place, and so that can be intimidating as a family member.
Very much so. The adult services world is just, it's a whole nother chapter that's just as stressful as IEP meetings. It's just as stressful as education plans and accommodations and modifications. So I think, I mean, the role as me as mom will continue to the day I take my last breath, but I'll also be advocate as well. David is very good at supporting his own needs and asking for what he needs in his own way. He is a non-speaking individual, but he does not let that stand in his way when he needs
Mhm.
something. And I see that in Zoe so much. Zoe's such a good example. She works with my daughter Kira a lot, and I've seen Kira be able to advocate for herself so much better since meeting Zoe and saying that it's okay to ask for what I need.
Absolutely. I always say, I think if you had to say, let me just choose this path for myself and my child, I don't know that you would. I mean, I wouldn't want my child to go through everything she's went through medically. I mean, I wouldn't change her for the world. But, with everything life throws at you, when you go through all this, like from day one, looking from where she started to where she is, I'm like, she's made me a better person, a more understanding person. And um, so I appreciate that about the process and watching her grow into an advocate, and watching David. You say, like,
Yes.
he's a non-speaking person. He may not always communicate everything verbally, but he does communicate. I mean,
Mhm.
not communicating verbally doesn't mean that he doesn't communicate or
Mhm.
have something to say. And
Yeah,
his
and unfortunately, sometimes people will look at someone that's non-speaking and think that means they can't hear either, or that they can't be
right.
a productive part of the conversation. And he lets it be known that it's false pretty quick. So
Right.
he does, and that's just, I think I've been a strong voice for him. There was a quote I think I read pretty early on in my autism journey that I will be his voice. And I've a very good friend of mine, I'm still very close with her, um, also an autism parent, showed me a quote from Dr. Seuss, and it was the Lorax. And the Lorax says, "I speak for the trees because the trees have no tongues." And that has followed me my entire path as an adult and led me into this amazing career opportunity. And you and I both get to share so many resources and so much help to families every day. And I remember back when I was in that position, I remember the first time I called Family Matters and spoke with Bonnie Patton worked here, and she was my, um, I don't think her title was information specialist then. I think it was called something different, but I remember starting to work with her. And I even vaguely remember meeting Nancy and Deb in the process. And then fast forward that 17 years later, and I'm here for an interview. But I kind of remember the whole thing. So,
It's funny that you talk about Dr. Seuss, because my mom always would remind me of the quote, I think from Horton Hears a Who, maybe,
uh
like, a
huh.
person is a person no matter how small, because they always started so small. And so
Yes.
it's funny that we have those ties to Dr. Seuss.
Yes, it is. I never knew that. That's something we just learned about each other, Carrie.
Yeah, definitely.
We're gonna go have to get matching tattoos, matching Dr. Seuss tattoos. So, Carrie and I set out this morning to make this a very short podcast. I knew it would run longer because we're both so proud of our children. And like I said, I have two more with an IEP and one more with a 504 plan, and I'm just as proud as them. It's just this is David's where I got my start in learning the special education process. So I have, I guess, more stories to tell about that. But so I like to end my podcast with one question. Carrie, if you could offer any type of advice to someone brand new to the special education world, what would that be?
I would say, don't feel like you need to know everything just out the gate. It's a whole new language. Like, and don't be intimidated. Like, if you meet another family, I've been working at Family Matters for going on 19 years. I've been a parent to Zoe for almost 23 years. So I've learned things over time. Just like when she was thrown into NICU, I felt like I would never understand all the monitors, all of her health needs, all of that. You learn it more quickly than you think you will. But I would say don't feel overwhelmed and feel like you have to know everything. I would say, know who your parent center is, know who to reach out to so you can get factual information, get connected to those resources so you can learn and appropriately advocate for your child and make educated decisions. I would also say, have high expectations. Yes, Zoe has disabilities, but that doesn't mean that she doesn't have wonderful abilities and capabilities to grow and learn, and have a fulfilling life and, reach a lot of her goals. So I would say just, don't let that completely define them. There's nothing wrong with having a diagnosis or disability, but it doesn't mean that you have to, be limited and can't reach goals. How about you, Abby?
You don't know what you don't know, and it's okay to ask questions. And don't look back and beat yourself up about every small step. Like every time there's a new piece of autism information that comes out there, I'm like, oh, I did it. I ate shrimp when I was pregnant, or oh my gosh, it's because I watched The Simpsons on Friday night. Like there's so many things you could go back and beat yourself up about. And I look back now and I'm like, oh, I wish I would have pushed for more OT therapy. Well, you don't know what you don't know at the time, and your team doesn't know what they don't know at the time. Don't go into it thinking everything they do is with a malicious intent, for sure. You're all there to educate your student, and everybody at that table wants your student to succeed.
Right. I think we're all lifelong learners and we're all learning. There is one quote I was just telling somebody the other day and you made me think of it. Like you do the best with what you know at the time, and when you know more, you do more. And I think, as long as you just really can't rehash the past. I think we all do at some point, but you don't want to live there and think, I didn't do enough. I mean, you did the best, you're doing the best you can. And as you learn more, you do more. And we're all that
Hmm.
way. We look back and there may be something that we're like, we wish we would have known this sooner or done
Sure.
this. But,
Yeah.
that's a process. We're not going to know everything.
Yeah, absolutely. Well, I definitely want to say that this podcast is with great, we got to bow down to David and Zoe to
Hmm.
showing us the path and where it led to, and hopefully helping lots and lots of others down their path. And I wouldn't change David for anything. I'm a lot like you. I wish I could take some of his struggles away so he doesn't have to fight so hard. But I wouldn't change him for anything. I couldn't imagine him a different person for sure.
No, I mean, they're perfect. And yeah, I mean, you don't want to see your kids struggle, but I mean, Zoe's personality and things, I'm like, she makes me laugh. She sees things sometimes when I can be negative about things and frustrated. I'm like, I look at her and think, you've been through so much and you like never rarely complain. So,
Mhm.
we learn a lot from our kids. And like I said, I think, I learn a lot from Dave, and I haven't really met him in person yet, but I, hear a lot about him from Abby and see things, and they make us better people for sure.
For sure. Well, thank you everybody for joining us today on our podcast. Like I said, we're going to try to release these as we get them in, and we've had great response so far to this. I'm super excited to see where this platform goes.
Thank you, everybody.
Have a good day.